लाइव हो गया?
सिस्टम को ना सेट करें आगे से।
ठीक। So, good afternoon, everyone. So, as we know that Integrated Association of Medical Basic and Social Scientists and Vigyan Bharati Punjab are jointly organizing webinars on various scientific issues. So, to address the epidemiology, control and prevention of COVID-19, on behalf of IMBSS and Vigyan Bharati Punjab, it's a great honor and pleasure that today we have Professor G.S. Thakur, sir, Professor of Department of Community Medicine and School of Public Health, PGIMR Chandigarh. Sir is also the President of World NCT Federation and the expert member of National Steering Committee, National Health Mission. So I welcome you, sir, and thank you so much, sir, for joining us.
So, thank you, Dr. Jitendra. It is indeed a pleasure for me to speak on this platform on epidemiology, prevention and control of COVID-19 and post-COVID strategy. So, during this presentation, I would like to take you to a little bit the background, the distribution of cases globally and in India. What is coronavirus? What is its mode of transmission? What are the key epidemiological features? And what are the prevention and control measures which we are taking at the national level? And what should be the post-COVID-19 strategy for a country like India? And what are the activities which we are taking up at the level of PGI as a national institute of excellence? Now, coming to the coronavirus disease 2019, we all know that in December 2019, a pneumonia outbreak was reported in Wuhan, China. And on 31st December 2019, outbreak was traced to a novel chain of coronavirus, which was given the name of 2019 novel coronavirus by World Health Organization, and lately it was called COVID-19, which is very commonly now being used. So this is just the timeline which has been for this disease from the very beginning. At December, Wuhan reported the cases. By 31st December, Chinese authorities alerted the WHO about the cases of pneumonia. From 1st January, Wuhan seafood farm market was closed. And on 3rd January, India notified by WHO. And on 7th January 2020, this virus was identified. And in fact, by 30th of January this year, we have confirmed this first case, and also WHO declared it as a public health emergency of international concern. There has been, accusation that China reported it very late, and also same is true about WHO, that they took a lot of time in reporting to about this pandemic and declaring it as an emergency, and this led to the potential spread of the disease. Now we all know that the cases are rising. We have almost 52 lakh confirmed cases all over the world. There are almost 343,000 confirmed deaths, and almost 216 countries of the world are reporting this disease. Now, if we see the situation in India, we have now the cases are also rising in the country. The number is more than uh, 1 lakh, which we have crossed, and there are almost 83,000 active cases. And the good thing is that 64,000 cases have been cured, and there are almost 5,000. We are approaching 5,000 deaths. Now, what is coronavirus? Coronavirus are the family of viruses that cause illnesses common to most severe diseases like severe acute respiratory syndrome, acute respiratory syndrome, and so mainly the problem is basically with the respiratory system. Now, there are various genesis of the sources of this virus. The virus Wuhan strain has been identified as the new strain of beta coronavirus from group 2B with approximately 70% genetic similarity to SARS-CoV virus. Intermediate, just coming to the reservoir of infection. The bats, which are known as gathered in the vernacular language in north part of India, appears to be the reservoir of the COVID-19 virus, but the intermediate host has yet to be identified. If we see the mode of transmission, the primary host is the bats, and they have been, there is a transmission to the human, and it is said that due to the consumption of the food which is contaminated with the virus, and we know that in Wuhan there is a wet market, and the foodies are that either it is from the wet market or from the Chinese direct laboratory. So from the human, there is a transmission from human to human, and this is how it is done. So this is the diagram which is showing that how the disease goes. That is, there is infected individual, and most common way of transmission is coughing. By coughing, the person will release the droplets, and these droplets they can travel a distance of almost 2 feet. And if anybody coming into the contact with us with these droplets, which are containing the virus, that is, we can go through the droplet, but at the same time, this virus can also spread, stay at the surface. That is, if the person is sitting on a table, the table is also contaminated, and if it is not disinfected properly, then again there could be a transmission. So for any disease, basically, it is very important to maintain and to interrupt the chain of transmission of the disease, and that can be done by working at the source level or breaking the chain of transmission and suppressing the disease. Now, this figure shows that how long does coronavirus survive on different surfaces. So on metal it is for 5 days, on wood 4 days, on paper 4 to 5 days, plastic 4 to 9 days, and glass 4 days. So you can see that the virus can be present on the different kind of surface for a long time. Now coming to the mode of transmission of this virus, there are mainly 3 modes of transmission, that is symptomatic transmission, shedding of the coronavirus is the highest from the upper respiratory tract from any person who is infected with the disease. Then there is a pre-symptomatic transmission, that is during the incubation period. Incubation period is the entry of the organism in the body and appearance of first sign and symptom. And here it is 2 to 14 days. And another peculiar thing about this virus is that this asymptomatic transmission is very common. We have large chunk of patients which are asymptomatic, and this is also a potential source of infection. If you maybe find a apparently healthy person, he may be, having asymptomatic disease and be a, potential source of infection. This diagram is, a little complex, but I would just like to mention that what is the reproductive number, that is the average number of the people that one person with a virus infected based on the reproductive number scale, right? And this is 2 to 2.5, that number of the secondary infection generated from one individual is 2 to 2.5 for COVID. And this is given for different diseases like H1N1, it is 1.2 to 1.6. For Ebola, it is 1.6 to 2. Right? So this is how, this is the reproductive number is important from epidemiological point of view. Coming to the epidemiological factor, it affects all age groups and also both gender, male and female. Particularly older people and people with chronic morbidities are more affected. Environmental factors are also important, but their role of temperature and humidity is not yet clear. And so who are at the risk? The people who have traveled to other countries in the last 4 days and their family members, people coming from other states if they have been working with people who traveled to other countries in the last 4 days, family member and contacts of the patients, and people older than 60 years of age, and people with medical conditions like high blood pressure, heart problem, respiratory diseases, cancer, diabetes. So if you see the number of deaths in the country, almost 3-4 deaths are above the age of 60 years, that is among the elderly. And 80 to 85% of the deaths are among the people who are suffering from chronic non-communicable diseases. So what is the incubation period of the disease? It ranges from 1 to 14 days, and most cases occur approximately 5 to 6 days of exposure. So what are the common signs and symptoms of disease? Most commonly reported symptoms include fever, cough, shortness of breath. But most of patients, that is 80%, experience mild illness, that is, or they are asymptomatic. So this is the common form which we see. Around 15% are having severe disease and 5% are critically ill. That is acute respiratory distress syndrome, sepsis, septic shock, which can happen. Now, what are the preventive measures? I was discussing this chain of transmission, and we have also discussed that we really need to break this chain of transmission. So this can be achieved that we have to attack the source, and source here is the cases of disease, but unfortunately there is no specific treatment. And so what is most important is that we need to maintain social distancing, that is distance between one person and another person, and minimum of 1 meter of distance is very essential. By having this much distance, basically we will be away from the droplet form of infection. Hand washing with soap and water should be done very frequently, and for 20 seconds minimum, hand washing techniques should be used, and if there is a water or soap is not available, of course sanitizers can also be used. It is very important that we should be, sanitizing our surfaces like tables, chairs, and other areas where we are working frequently, so that there is if there is any source of infection on the surface, that can be taken care of. One of the very important way of any viral disease is to control or prevent is the use of vaccine. Unfortunately, we do not have vaccine. So, in the absence of any specific treatment or vaccine, we need to basically take the chain of transmission by social distancing, hand washing, disinfection of the surfaces, cough etiquettes, and all these things have to be taken care of. We really want to prevent. Now, just to give a glimpse of what has been done at the national level, the screening of travel from COVID-19 affected countries was taken up from the very beginning, and I think I would say that our Prime Minister and this government has been very active in introducing all preventive measures, isolation of the disease and quarantine of the exposed person. So if there is any case, they need to be isolated so that they are not becoming a potential source of infection. And those who are exposed to the cases, they need to be put into control. We all know that we have experiencing the lockdown in the country, and this is the fourth phase of lockdown which is going on. Now, there are micro plans for containing local transmission of COVID-19. So this is happening wherever we have the people and a cluster of people which are suffering. There is a cluster containment strategy. If we are finding cluster of cases, then there is a containment strategy which is applied at the national level. Now, if there are more than 15 cases in a district, the containment plan for large outbreak is light, and if there are cases less than 15, the containment plan for the cluster is applied. And the districts in the country, they have been categorized into three zones, that is the red, green, and orange zones, and different districts are there. For example, we are in Chandigarh, and Chandigarh is in the red zone. Our adjoining district, Mohali, is also in the red zone. So this is how categorization of three hotspot zones, almost 130 districts in the red zone. So they are changing, as per the criteria, orange zones and green zones. So we still have many districts which are in the green zone as well. The government has also initiated district-based surveillance for COVID-19, and objective is to monitor the trend of prevalence of SARS-CoV-2 infection at the district level. So this will be undertaken in the facility based, that is for around 10 health facilities, including 6 public and 4 private health facilities, and for low-risk population, these are outpatient attendees and regularly, which will be screened for this. So this is the sample size. So in any district, there are 100 healthcare workers are considered to be high risk group, so they are 100 to be taken. And for low risk, these outpatient attendees, any people who is attending the OPDs and non-ILI patients, that is non-influenza like illness patients 50 and pregnant women 50. So this make around 200 people are to be screened, and almost 800 samples in a district per month. This will tell us that what is the trend of infection in the high-risk population, that is the healthcare workers, including doctors and other staff, and the low-risk population, that is the outpatient attendees who are not suffering from any influenza-like illness or flu-like illness or pregnant women. Now, this is a very important question, that what should be our post-COVID-19 strategy and how we will come out with these cycles of lockdown. Friends, we have to live with this virus. It is going to stay. It may not go as soon as we expect. So we have to live like other diseases like tuberculosis, dengue. Right? So we are living with H1N1. So we have also to live with it. Second important thing is that we have to work. We cannot keep our lockdown country for indefinitely. After all, we are a big country. We have to feed the people as well. So we have to learn that how to work during this period of the COVID is going to stay with us, and we need to focus on, these social distancing norms has to be established in our offices. Government has already released the guidelines for workplaces, that how they need to, adjust their working style. These hand washing facilities should be available in the offices, and sanitizers should also be available. And till the situation stabilizes, all of us should wear the mask as per the state plan which is available. Now, there is a exit strategy available at the national level. The document has been released, but the states, they have to work out their own exit plan, that how to come out of these lockdown, and it will happen gradually. It cannot happen in one day, and so gradually we need to open up our economy. This is not only a health crisis, but this disease has become a humanitarian crisis. In our country, you have seen that many people, they are migrating. What is the problem which, as a health expert, we are visualizing? That till now the infections was, localized in urban areas, and when so much migration on a large scale is happening, infection is spreading to the rural area. So effective supervision and monitoring is very, very important. We really need to, convince the people that, wherever they are, they should try to stay. We should restrict our travels, and we should try to have as many virtual meetings as possible, and physical presence should be undertaken only when it is required. At PGI, we are, the National Institute of Medical Excellence, and we are in the forefront of this war and fight against the COVID. Uh, we are the only COVID hospital in the Union Territory of Chandigarh which is admitting the patients, and also catering to the patients from third journey areas. PGI is also running a Corona helpline, which is having a number of 2755 which is functional from 9 a.m. to 5 p.m. Besides this, we have come up with a lot of health education material. There are many videos which are available. There is a PGI MER COVID-19 portal, and most of these things are available on our website. In fact, way back around 2 years back, we started with Islam Namaste campaign in our campus, because most of the diseases are transmitted by our hands, and we have a very good culture of you know greeting the people by Namaste, Namaskar, Salam, and Sat Sri Akal. So we should promote all these Indian way of doing things because we
Sites of question.
so we will be that way not touching each other. So I think we need to promote our culture and Indian way of meeting the people, and luckily it has been captured by many other countries as well. We have lot of IEC material which is also available on our website, and there are 6 posters which are available in Hindi. There is an information booklet on global coronavirus. There is also a booklet on frequently asked questions in English and Hindi. They are available in our website. You can download from the website, print them, and distribute in your respective workplaces, and that can be taken up. Just to conclude my presentation, I would like to emphasize that, as I mentioned, that almost 80 to 85% who are dying with these diseases are suffering from chronic non-communicable diseases like diabetes, heart disease, cancer, chronic lung disease. And so, in this situation, the World Density Federation, which is a professional association working for non-communicable diseases, it has taken this fight, and especially you know uh, working on that how to take care of the patients with the non-communicable diseases during this time. So it is very important that we should be taking the treatment for chronic diseases regularly during this time. We are also coming up with a special issue of International Journal of Non-Communicable Diseases, which is a official publication of World Health Federation on COVID-19 and non-communicable diseases and how to address them. For details, you can visit our website www.worldhealth.federation. So this is all which I wanted to share, and I will be very happy to take up any questions which is there. Hello.
So, side में पढ़ने पड़ेगा YouTube में. How app is आरोग्य? एक दो क्वेश्चन.
So now coming to the questions, there are few questions. Hello. So I'm just scrolling down the questions. So So there is one question that how Arogya Setu is helpful. Right? You can read on the question. So Arogya Setu is basically a tool which is being promoted. So this will help you to assess your risk for coronavirus, and accordingly you can, take the benefit of assessing the required health facility. So there is another question that from visual, what may be the reasons for higher recovery rate in India? So our recovery rate was low, but I would say that it has improved substantially once we have our discharge policy. This says that you can discharge the patient after 10 days of treatment if there is no fever for the last 3 days, even if the patient is COVID positive. So, and so it has definitely improved our recovery rate, but at the same time, we have to keep in mind that these COVID positive cases, that is the persistent positive cases, are also being sent to the community, right? And we do not know whether this positivity is due to a dead virus or a live virus. So another question is that how long the social distancing has to follow. Uh, as long as the problem is there, and that our peak is still rising, the number of cases are still rising. So I, we have to maintain social distancing. We have to make it as a norm of our living now until the situation is under control. So there is another question: how much time will it take for herd immunity to develop? Very important question. So as of now, we cannot say that how much time it will take, but what we are seeing in our country, there might be some asymptomatic cases which are there. So, as our epidemic will progress, this herd immunity will keep on, developing, and eventually, when we will reach a certain threshold, then definitely. Uh, so it is very difficult to tell what is the exact time by which we will, achieve the herd immunity. There is another question in gargling, drinking warm water, and steaming helpful. Yes, definitely they are very helpful in prevention. We should take plenty of fluid orally, and we should drink warm water as well as steaming is very important. So that should be. There is another question that what is the progress of the vaccine preparation, in which stage it is. So, there is a lot of competition as far as vaccines are concerned. Around 80 to 100 potential vaccines are being tried and developed all over the world. But we have not reached to a stage where, we have gone to the human trial and eventually for introduction into the disease system. There is another question that how much help the mathematical model to predict the COVID speed. I think they are important tools. This modeling, basically, you can tell that how this infection will progress in a specific state, so that we can make our contingency plan The preparedness is very, very important in any outbreak situation. So if you have good models for prediction of your outbreak are available in place, then it could be a good tool for prevention and control strategies for this. Now, there is another question. Does anybody test positive for corona in the flu patient? So let me share with you the data from Chandigarh. One third of our patients in Chandigarh are persistent positive. That is after 14 days of treatment. Right? So it is very difficult to say whether they are truly patient even after 14 days. But now there is a discharge policy of the government of India, and they say that you can discharge the patient after 10 days of treatment, and if there is no fever for the last 3 days. So this policy has also been applied to Chandigarh. So after 14 days of treatment, PGA has also discharged some of the patients, and they are being sent to the post-discharge center, which are established in the Chandigarh, and they will be kept here for more 7 days before they are sent to their home. Zinc and vitamin. There is another question on is zinc and vitamin D supplement help intervention? Yes. So vitamin D deficiency is very common in our country, despite the fact that we have enough sunlight. So such type of supplement can be given in our sector. So thank you very much. If there are no more questions, we close here. Once again, thank you all for your patience. I'm sorry if there is any, because some of you have mentioned that there is some problem in the voice, which you are not able to hear. But this presentation will be available on the YouTube. You can view it, and if there is any question and any discussion which is required, you are most welcome to come. Thank you very much.